Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. Today, we have the pleasure of having a fine gentleman and dentist on the program with us today. Dr. Charles Samaras, say hello.
Good morning, everyone.
So grateful to have you here. Thanks for taking time out of your day. I'll start the episode by asking what I ask pretty much everyone is, how'd you get into dentistry? How'd you become a dentist?
It was interesting. I knew from a very young boy that I wanted to be a doctor. In fact, in first grade, they asked us to write down our thoughts and feelings and what we wanted to do. And I wrote down that I wanted to be a doctor. And they kept these for posterity, that you can go back and see them. Now, as it evolved, I wasn't sure exactly what kind of doctor I wanted to be. And instead of choosing the physician route, I chose the dental route for several reasons. And it ended up being the best decision I ever made. It's been a wonderful career so far, still going great. I like the dentist. I like my dentist. I had a very good friend who was a dentist, and he kept saying to me, this is a great career. He was older than me, about 6 years older than me. And he was right. And I ended up going to the same place he did.
So practicing for 40 years, is that right, roughly?
Yes, that's true.
Yep. So you've been around a bit. You teach as well, correct?
Yes, I teach a lot, as a matter of fact, and it's something I'm very passionate about. A lot of the people that I teach I do teach some dental students in dental schools, but the majority of my teaching training of this technology and practice management are to recent graduates. Graduates that are 1-2 year out, they're in residencies, a lot of them, and they don't have a lot of experience or education about this type of technology or practice management in general, how to really conduct themselves no matter what choice they choose, because they have really a plethora of choices as to how they want to practice, and they're not always exposed to that in school. Now, when I taught the practice management course at Tufts and I started it, I'd like to have these students think about all their choices, because what they might have thought they wanted to do is not what they may want to do. They may not have ever thought about a career working for a public health clinic or in the military or a VA clinic. They thought maybe private practice, and that's fine. They may have even thought of teaching. I never thought I'd be teaching when I was in dental school. So there are a lot of choices for these doctors. And as you can tell, I hope you can tell from my voice, I'm passionate about this. I really want to help these young doctors because they have a fabulous career in front of them, but they have to make some very good and prudent decisions as to what they want to do, but how they want to study and what they want to learn in order to get there to provide that service of that we want to provide to patients. Excellence in service. That's what we're about. Yeah,
and that's fantastic. And I think it's some interesting things that you bring up. I think, and it's certainly not true, but I think that a lot of what I mean, let me back up just a little bit. Okay. I think a lot of dentists think there's one career path. Right. They think I'm either going to do a startup or I'm going to buy a practice. And but there's actually a million different paths out there, right? Or I should say there's hundreds of different paths out there. And some of these paths may be much better than what you believe that you're supposed to be doing or what you originally thought that you're supposed to be doing. So, I know we're going to jump into technology, but real quickly, where would you go to learn about all of the different opportunities that there are in dentistry once you're a dentist or you're in residency?
I think that you should go to as many courses as you can that are provided at these dental meetings. And online, these courses have been fantastic. One of the really good things, there weren't a lot of great things about COVID, but one of the real good things is we all turned to, webinars and podcasts, and we learned a lot of information was disseminated during that time because doctors had a chance to really slow down, or they were stopped and had a chance to think. Especially the younger doctors, schools were closed. They weren't allowed to see patients. So a lot of them, if they were smart, they spent their time listening to this type of education. And that's where I would go. If I were a young doctor, I know what I did. I went and I saw dentists, and I looked through different offices, and I said, who was happy and who was not? Who was really enjoying their profession? Who was not? And I also went to leaders, and I found out why leaders in the community were happy, why they were successful. And it's because they really opened their minds to different types of ideas and education. Now, the students at Tufts that I had, I exposed them to all this. I had people come in from all the different professions, from the military, from the different types of opportunities they would have, just to get them to think, not to tell them what to do, but just to get them to think.
Yeah. So we're going to switch gears here a little bit and talk about of all things technology. Now, usually, we all like to generalize and we all like to stereotype. Right? I think it's a discipline to remember not to do those types of things. You've been practicing for 40 years, and
Right.
You're excited to talk about technology in dentistry this morning, right?
Right. And it's interesting because I'm not a techie. I mean, sometimes I have to have my daughters extricate me from some of the technology things that I can't get myself out of. However, back many years ago, it struck me that technology was the future of dentistry. And I have written, I don't know if you don't know this because of my website, but I used to write a lot of articles in the dental magazines, a very, common dental magazines that I used to write for.
Yeah, and I see that, by the way, and I'll just let you know. I mean, you can find articles on Dental Town, Digital Dentistry.
Right.
They're everywhere. Raving Fan Practice. I mean, yeah, you just
Right,
Google
exactly. Thank you for saying that.
Yeah,
And,
you see them everywhere.
And I used to talk about digital records back in the 90s. And I used to say that you really should have this type of technology. So I just wanted to be on the cutting edge. And interestingly enough, I used my younger team members, assistants, hygienists, managers who were much younger than me. They helped me with the technology and I helped them with the vision. And so it was a great marriage, and I talked about all these things in digital. Even though I wasn't, really up to it, I learned it.
Sure.
It's like learning a language, like learning a foreign language. And so we incorporated all these things. And I remember writing years ago that I said by 2020, more than 80% of dental practices will have some type of digital imaging in their practice. And I remember some of my colleagues saying to me, Charlie, that's crazy. Well, I think that's come to fruition. It's more than 80. And so I just thought technology was the way to go. Even if I knew it or not, I would know it.
Sure. So let's talk about scanners. I know that's something that, it's coming up a lot right now, right? I think we're kind of at a point where a lot of people think that either everyone should have one, and then some people practicing are saying I've only got 2, 3, 4, 5 years left, and it doesn't make sense for me to adopt this technology. For those people, tell me why they're wrong. Tell me why they should be open to this.
I think they should be open to this because the younger doctors now are used to technology. Where we had to learn technology, they're born with it. It's almost like when you're born into a family like I was that spoke a second language all the time. It's just part of your nature. And so you can speak the second language as well as English. Well, it's the same with them with technology. They know it. And so a practice is going to be much more attractive to a younger doctor to either purchase or work in when they have this type of technology, because they're being exposed to it and they know that technology is the future. They get new cell phones every 2 years. So 5 years to them is an eternity. They don't expect to have their cell phone or all these other digital technologies that they have in their life. So I believe it's better dentistry. This is why I would never say anything to a colleague. I respect my colleagues. I respect my physician colleagues as well. They're going through a tough time. But I would never tell a fellow colleague what to do. However, the benefits that I see, not just for the doctors, the benefits are always for the patients. And digital imaging, what it does is it gives you instant feedback on what you're imaging. And you can make that decision rather than having to take an impression, send it somewhere, and then get the information 3 days later. Well, wouldn't it be great if I had the patient still there in the chair and I can see where I need to correct something, redo something, prep something. I get the information right there. And not only that, Patrick, but I see this information at 30 times magnification, which I can't see with my loupes. Okay,
Sure.
so doctors that are looking with loupes that are 3 times magnification, 4 times magnification, it is humbling when you see your prep and your image at 30 times magnification.
Right.
All right. So I think it makes us a better dentist, and all that provides better excellence and service for the patient. My mission statement is to provide clinical excellence and excellence of service. It's written in many articles that I've written. You may have seen them. So that's why I think they should get into digital imaging. It makes it better.
Yeah.
It makes
So
dentistry better.
from the consumer point of view, I think that case acceptance is often talked about in the realm of, or the spirit of profitability, but it's also, case acceptance also means better healthcare for the patient.
Correct.
And I can tell you from a consumer point of view, when a consumer sees that scanner, it feels absolute to them. It feels exact, right? It's like, robots don't lie, right? Is kind of a mentality that people have. Computers don't lie, even though we know they do, but they kind of think that. So I think case acceptance will go up significantly when patients see this type of technology in use. What do you think about that?
I think that's absolutely correct, because as I've said many times and I've written many times, patients understand what they see, not exactly what you tell them. Right. So when they can see that, they say, oh, well, I really get this now. That's my tooth. That's how fractured it is. And you say, yeah. And they're the ones that are convinced, say, yeah, I'm surprised this thing isn't killing me. Let's restore this thing.
Sure.
So I believe that it's the best form of communication when we can show patients what's going on rather than telling them. And as an added benefit is we are creating a digital record of everything on that patient. So not only am I writing notes about a patient, I have pictures to prove it. Sure. So when you're talking about, liability and stuff like that, well, I got pictures to show before and after. Virtual documentation is great.
Yeah, I remember years ago going through an elective medical procedure that I was all ready to go. And I think the day before, or 2 days before the procedure, the doctor's office sent me a video of what the procedure looked like. And I was like, I'm not doing that. And I think with impressions, I think a lot of times that the treatment that the patient's going to have, the impression is actually the worst and most uncomfortable part of that. But I think in people's minds, they go, wow, that was so uncomfortable, the impression, that whatever they're going to do with that impression has to be more uncomfortable than the impression themselves. Do you think that's true in the patient's mind?
Well, I think that now the digital impressions are just so much more comfortable than the other impressions that we used to take with the alternate, where it's going down your throat and it's there, for 2 minutes, or, the other impressions that we take, final impressions that were there for 4 minutes, those are extremely uncomfortable. You can't breathe. I think most patients, when they're exposed to digital impressions, they say, that was pretty easy.
Yeah.
And I can see it a lot better.
Yeah. And what I was referring to was old impressions, right? Not the new digital impressions. Yeah. I've had both. And the digital impressions from a consumer point of view, it's a fun experience. I mean, the only thing that I can think of that it's similar to is like an ultrasound, right? I mean, you're just like watching it. It's really neat. You're like, wow, look how exact that is. I mean, it's just absolutely fantastic.
Patients believe that I can remember when I was using my CAD CAM technology. I mean, and when I started, there weren't very many doing this. And I remember the patients, we were showing them these images and stuff. And they say, wow, Dr. Samaras, you're on the cutting edge. And I was like thinking, well, I'm really kind of on the bleeding edge here, because this is really what, it's new. But they were so impressed. And they say, thank you for doing all this and taking the time to learn this type of technology. Or the first time I used a laser or something like that, they were like, this is fantastic. And you're doing all this for us. That's sure there are some skeptics anywhere, but I believe the majority of the patients saw this as, creating treatment that was better and more comfortable for them.
Yeah. So, Dr. Samaras, first I want to say real quickly, I know you've been practicing for 40 years. I know our audience can't see the video, but you must have got out of dental school when you were about 10.
Yeah.
So you're looking fantastic. But I want to ask you this last question before you go today. Maybe one piece of advice that you'd give a 25-year-old dentist just kind of coming out of school or just finishing up a residency program.
I would say surround yourself with very good people. Surround yourself with a very good team. And I don't mean just team members in the dental office, but without the dental office. A young and when I was at Tufts, I gave the students had a checklist of all these things to do, and I hope schools will do that. But surround yourself with a good mentor. Find a good mentor that can help you navigate your way, negotiate your way through this tough time. Get yourself a very good financial planner. Because believe it or not, you will be able to save money because I'm going to advise you to get a very good dental CPA. And the students ask me all the time, how can I afford one? And I say, doctor, you can't afford not to have one because they understand, finances, and they'll find the money that you can invest. And then I would say really spend a lot of time in continuing education, because the day you graduate from dental school is the first day of your dental education, not your last.
Sure.
And you have to keep learning. You just have to be a sponge and just get out there and learn as much as you can about the profession. The other thing I would say to the doctors is get themselves financially stable. And that's part of, how you would choose your career too. Find yourself a position, and you don't have to do it for a long time, but you might go and work at a VA clinic, which is a very pleasurable experience. It's a fixed salary. You know what you're going to get. There's continuing education involved. There's mentors. There's residencies. Now, it may not be the glamorous position that you thought as being a private practitioner in Beverly Hills, but it's a very good profession there. You're going to learn a lot. These military bases, VA clinics, Indian Health, which I've done in the middle of nowhere, that have been so pleasurable, they have the technology. They have, and you have time to learn, and they'll teach you. It's a fabulous experience. And if I'm a young doctor, 25, just getting out of school, I'm thinking I can take the next 3 years and learn so much. I can get myself financially stable. I'll have continuing education every day with a mentor, but outside education too. And I can have a great experience before I decide, or if I decide I want to do something else.
Yeah. Dr. Samaras, I want you to come back on the program for sure, but I want to thank you again. I know you've got a lot going on. And thank you for taking the time to help young dentists, old dentists, medium dentists. Thanks for talking to our audience. Thanks for being here.
It's absolutely my pleasure. Anytime, Patrick. I hope you can see my passion, or you can hear my passion in my voice, because it is a passion. That's why I teach. I absolutely love it. And thank you so much for inviting me. Sydney really was the one that connected with me on LinkedIn, and I want to thank her. So thank you very much for having me. It's been a pleasure.
Yeah, thank you.
All the best.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.